Hi everyone, so I'm Jackie, I'm the Group Manager of YMCA North. I look after recreation, aquatics and fitness. I have Casey. Casey's my Regional Fitness and Recreation Operations Manager, and I also head up health and safety for the YMCA. So we've sort of broken our presentation down into a game of two halves. I'll hand over to Casey, who will take you through the first part. And that's really where we're going to overview the YMCA service, how we looked at the YMCA services and really understanding the measures, and then we'll take you into how we're going to manage risk moving forward. So, yep, with that, I'll hand you over to Casey.
Thanks, Marla, and thanks, Jackie. So to start with, not sure what everybody knows about the YMCA in terms of what we offer. But there's a few different sectors that we play in. We've got the accommodation sector, where we've got a hotel and hostel here in Auckland. We've got 2 outdoor camps. We've got a significant before and after school care holiday program and ECE part of the business as well. But the area, as Jackie mentioned, that we look after is primarily the fitness, recreation, and aquatics section. And so for us, Sam, if you go to the next slide there, in level 4, there's not a heck of a lot happening in terms of actual service delivery. We've got a little bit of fitness going on, and our accommodation business is still operating as an essential service. When we move into level 3, if you go to the next slide, Sam, we pick up a little bit of our childcare business, our early childhood centers, and our before and after school care, being able to support the additional workforce going back to work at level 3. But when we move to level 2 here, we see that we expect all areas of our business to be operational. And so I guess what we wanted to talk about in this first part is how we come up with our return to play plan for these areas, and understanding that what we want to do is answer this question of how can we operate. So there's these restrictions and these measures in place that we absolutely need to follow, but how can we operate? So if you go to the next slide, Sam, and we look at it in this 3-step approach. First step being to understand, second step being to translate, and then the third step there is applying that understanding. So next slide, Sam. The understand components. For us, this is really about what the government says, and reading and being there on those calls to get an idea of what it is that the government is expecting from the people of New Zealand. And more than that, it's also about getting an understanding of the actual environment that we're operating in, what sort of risk is out there. And, for example, with Delta here, we know that the airborne transmission is a lot more of a risk. So, getting an understanding of that kind of public health environment of what we need to be doing. So there's that government level understanding. And then the next bit is this translation bit on the next slide there, Sam. And so there's the government measures that are put in place. And then we rely heavily on the supporting national bodies for each of the sectors that we operate in to liaise with government and translate those measures into what they mean for each of our different areas of business. So, for example, here we rely heavily on the Exercise Association of New Zealand to figure out what does 2-meter distancing mean in terms of capacity for a gym. We rely on Sport New Zealand to have that conversation with government and define what that means in terms of how can you play contact sport when you're trying to have a 2-meter distancing. So really making sure that we're drawing on the government information and then looking at each of our specific areas and finding out as much as we can about each individual sector. So from there, we move on to the next slide. We look at applying it, because we know that each of our sites is different. Each of our services, we've got a large range of services. So it's taking that government understanding, the translation of what that means for our business areas, and then applying that understanding and those principles to how we design our protocols for each center. So that could include things like how we're laying out the equipment, how we're laying out our gymnastics classes, how we're designing the way that participants are going to enter and exit a facility, making adjustments to programming, scheduling, class structure, and staffing. And that's kind of the flow we go through, is the top down, getting into that granular detail of what does keeping 2 meter space in a meeting room at Mount Albert mean. So if you go to the next slide there, Sam. So if we look at our YMCA Mount Albert facility as an example, it's primarily a fitness facility, but there's a significant recreation business there where we offer kids recreation programs, gymnastics, and basketball. We've got a lot of hire in that space as well. So people, volleyball groups or badminton groups hiring out our stadium. We've also got a lot of meeting rooms there, which part of the facility is a community center. So for us, in terms of getting to that granular detail at one of our facilities, for fitness, looking at the Exercise Association guidelines, and then going and saying, okay, if we need to maintain 2 meter spacing in our fitness facility, what does that look like in terms of the actual number of people that we can fit there? For recreation, is if we are running our gymnastics classes and we can only have 50 or now 100 people in that indoor space, how can we make sure that the different groups aren't crossing over and that we're utilizing different entry points and exit points to make sure that we're minimizing contact? And in terms of hire, similar to what Scott said, we rely in part on our hire groups, the people who are coming in to use the facility to play a part in respecting the guidelines. We'll have our own that we're expecting in terms of everybody's scanning in or registering their visit. But we also expect that if a community group is hiring out our stadium to play indoor soccer, that they will also be following those Sport New Zealand guidelines in terms of how to play sport safely. So that's kind of the first bit of this presentation in terms of how we figure out how we can actually return to play for what we do. And I'll hand it over to Jackie to talk through that risk assessment component.
First of all, are there any questions for Casey at this point?
No questions have come through so far.
Okay, great. So from my points, this was more of me having the health and safety hat on. And the first thing that we've identified is Delta is different. So, there's a lot of talk out in the community that Delta is like a whole new virus. And more importantly, the thing that from a health and safety perspective that I've been focusing on a lot is that moving forward, we're going to have to learn how to live with this virus. And we are going to open up. There is going to be more community transmission. So on the, making sure that we've taken all practical steps to keep our staff very safe when they're at work, we've developed what we call a risk assessment calculator. And what that does is, the first thing we identified is, first of all, what is the role? So as you can imagine, in the YMCA, with all our different divisions that we have numerous roles. So we've grouped the roles into like roles that sort of have the same exposure or do kind of the same job, even though they're in different areas of our business. And from there, we've looked at the risk factors associated with each role. So when we've looked at risk, are they customer facing? How much contact do they have, adult facing, child facing? And then we also, the second thing that we looked at was environmental risk. And that was how much movement takes place in shared spaces. Do we look at how much exposure do they have to public spaces? And a simple thing would be a fitness instructor. The first thing we talk about public spaces and public bathrooms. part of the fitness instructor's role is that they do regular bathroom checks and general cleaning in the bathrooms. So they're exposed to a public bathroom, they're exposed to the staff bathrooms. From there, we've used a scoring system that actually gives us what is the likelihood of each of these roles being exposed to the virus should it enter the building. From there, the next thing we looked at is what is the consequence for any staff member who contacted the virus, and this is no different to any risk assessment that we do in our business. And then the second thing for each role is to identify what's the likelihood of them getting it. So that's a scoring. We actually get a score for those two things, and then we come up with the overall risk for the role. And as you can imagine, when we work through this matrix, we end up with some extremely high risk roles. And then when we look at more of our support office division, the risk drops with each of those roles. Through research, we've found that the three main things that as an operator we can control is social distancing. We can control mask wearing to a point. And the other thing we can control, and that positively impacts, is a positive thing against the transmission of the virus, is good ventilation. So those are the mitigators that we put into our calculator to identify, of those three in each role, how easy would it be for us to implement those things. From then we'd come up with the risk score, taking these mitigating factors into account, and that gives us our residual risk for each staff member. The one thing that we've built in is around vaccinations, because at this point it's a bit of a minefield out there with regards to who you can ask, what you can ask. Can you say staff must be vaccinated? So all this calculator is doing is we're then going to build into the calculator what percentage impact would it have on a role if the person was fully vaccinated. And if we look at international research, they're saying that a vaccinated person, to improve your percentage by about 80% of, you could still contract it. Yes, we understand that, and you could still pass it on. But the chance of you getting desperately ill and being hospitalized is 80% improved. So we build that into the calculator, and then we come up with the final risk figure, which allows us to look through our business and go, are there still areas of our business that are very high risk? And then what else we can put into that to make sure that we keep them as safe as possible. So, yeah, I can show you what the calculator looks like, if that would make it a little bit clearer, because I'm sure that was as clear as mud. If anybody would like to see the calculator, let me know, and I can certainly run you through how we're doing it. No?
No, nothing coming up.
Okay, that's great. Yeah, so that's really where the YMCA is. As Casey said, we've done it before, and in the first time round we prepared reopening plans, which we have in place, and the centres are working through that. And yeah, we're looking forward to getting back to play. So thanks for listening, and hopefully somebody got something out of it. And thanks to Sports